healthcare industry today. John Holiver from CharterCare. As I think folks know, CharterCare oversees Roger Williams Hospital and also Fatima. You're becoming a big player in the marketplace. Today you made a major announcement. You announced that an effort to bring back Memorial Hospital, which was closed on December 31st or January 1st. Talk a little bit about the decision to move forward with that.
Sure. Josh, first of all, thank you for having me on the show. It's great to be here. Secondly, our opportunity to look at Memorial and to move forward really comes from a groundswell of invitations, not only from the three mayors up in that area of Rhode Island, but also from the number of patients that we see on a daily basis in our other two hospitals. It's really wonderful to be able to fulfill and fill a need as far as healthcare up in this underserved region.
So in Northern Rhode Island, I'm not sure everybody completely understood. I mean, Memorial had been struggling for years on patient count from a standpoint of folks in the bed. But I don't think people understood of what the implications were when they closed it, of what the impact was going to be on emergency rooms around the state. You know, rumors are, stories are, anecdotal as they are, is that Miriam was backed up, you know, functionally up and down the streets, and there were multiple hours. That's a very unusual situation for Miriam, and really points to the demand and need for more healthcare coverage.
You're absolutely right, and we saw that at Roger Williams as well as Our Lady of Fatima, and we saw that Miriam would be on diversion, which is not allowing emergency vehicles rescued to come into their facility, strictly because they were overwrought and overrun with
I got to
patients.
tell you, I used to be the city councilman in that area of the city back in the 90s, and I don't ever remember that ever happening in the history of Miriam. If it did, it was beyond my time period.
Well, we have to keep in mind that even right before it closed, Memorial Hospital saw an average of about 100 patients a day in their emergency room. So while the infrastructure in the rest of the hospital was not functioning to full capacity, we need to keep in mind that the emergency room and its urgent care area was still vibrant and running.
And Memorial for, you know, I don't know how long, 5-6 years was so underfunded, both when it was an independent hospital and then when you know, the other hospital group, Care New England, took it over and was bleeding out $30 million a year for 2 or 3 consecutive years. They were not pouring a lot of money into that. They were not keeping up with the needs of the infrastructure. How can you be successful when others failed so miserably? I'm going to be blunt about it.
Sure.
The numbers are pretty clear.
They are. We're very confident in the CharterCare model that we run, and we've actually proven it in this state, as we have in 5 other states. In the CharterCare model is very simple, is that we run hospitals very efficiently. We get patients in the door. My average wait time in the emergency room is about 15 minutes, and it's not due to the lack of patients because we see over 100 patients in each one of our emergency rooms on a daily basis at Our Lady of Fatima and Roger Williams. It's the different processes that we have put in place and the people that we hire to make sure that we can take care of our patients in a very expedient fashion. The second thing that we do that I think that's very unique is that I come from a hotel background. I worked for Four Seasons Hotels for 10 years, et cetera, and what we do is that we really go out of our way to give the PX, the patient experience, to all those who come through the door. And what we're seeing is that more people are voting with their feet, coming to our hospitals, and that's what we're going to try now and relocate to Memorial Hospital.
Bob Whitcomb, who was for a very long time the editorial page editor at the Providence Journal, before that was at the Wall Street Journal, is a columnist for Go Local now. And he says, listen, the difference between for-profit hospitals and not-for-profit hospitals is one pays taxes.
He's absolutely correct.
Why do for-profit hospitals have a different reputation than not-for-profit? I mean, you've seen in Rhode Island, you saw Care New England lose $130 million in a little over 2 years. You saw Lifespan's got a little bounce back towards profitability, but had some massive losses. You did not have that. You can't have that.
Right.
What's the difference?
The only difference, as you just said, is our tax status. We pay taxes, and the not-for-profits do not pay taxes. Now, I've spent my career working in both,
Right.
so I know that to be a fact. The second thing is, even not-for-profits have to make a profit
Right.
at the end of the day.
Yeah.
You know, my 94-year-old father was always questioning me, why did I work for not-for-profits and work for a losing company? And I had to explain to him over his last 40 years or so that we are not-for-profit in tax status, but we have to make bottom line dollars of profit so that we can reinvest in people, plant, technology, and just keep up with the everyday works and depreciation of the buildings and equipment.
So within about 7 seconds of you making the announcement, one of the more prominent unions sent out a statement. They're not wildly excited about it, and you've obviously had different relationships with them over time. How do you get them on board? How do you get those folks, the nurses union primarily,
Right.
Involved in this and see this as a positive rather than as a negative?
Well, I think that's, Josh, that's a great question. And what we're endeavoring to do right now is that, the union leadership, very smart gentlemen. I have a lot of respect for them, and they do good work for their members, et cetera. And I think one of the things that we've been doing, at least in the 2 years that I've been here, is we've been using outside folks to kind of adjudicate our relationship with them. And what I want to have happen now is go local.
Yeah, right.
Let's go local. So let's have, the local lawyers.
We've got a little room back there. We can work this out in an afternoon.
We can do that, but actually sit down, break bread with Jack and with Chris, meet, talk over what the issues are. I think we have common goals as far as what our nurses, the workloads that they should have, and pay schedules, and actually the future. Where do we want to go as a company? Now, if you look, there are a lot of struggling systems, healthcare systems in the state. We have come really from the ashes over the last 3 years and put us to a place where we're doing okay. We still would like better rates.
Yeah,
and
that's right.
We'll talk about that later maybe, but at the end of the day, we're able to provide a modest increase to all of our members and to all of our employees this year. We have put $90 million back into the facilities at Our Lady of Fatima and Roger Williams, and we've actually modernized it, brought new equipment in, and been able to, again, to give these raises and market adjustments where needed.
One of the big market factors right now is with Care New England's financial instability is their negotiations with Partners Healthcare Boston. Partners is an entity, and we've written a ton about it. We actually broke the initial story about it, that has an annual budget of over $13 billion. It's about almost 50% larger than the state of Rhode Island's annual budget. They have 70-something thousand full-time employees.
Right.
This is a megalopolis. Now, right over here is the Hospital Trust Building.
Okay.
And for many years, thousands of people worked in that building, and Fleet Bank owned it, and they went out and bought other banks around the country, and more people worked there, and more people worked over there.
Right.
And it was great for the Rhode Island economy.
Sure.
You forget parking down here. You couldn't walk through the arcade at lunchtime, it was so crowded.
Okay.
And then one transaction too many, they get sold to Bank of America, and that building has been empty for 5 years.
Right.
I haven't seen in my adult life, next door over there is Providence Gas Building and National Grid. Once the out-of-state entity comes in, kind of lose control and the number of jobs decrease. It's a major, major concern. We've had the governor here talk about this issue. We've had Stephen Pryor talk about this at Commerce. We've had the Speaker of the House. How dangerous is Partners coming in and that consolidation for the Rhode Island economy and for jobs in Rhode Island?
Well, I think, Josh, that certainly CharterCare, we've been very clear on what our stance is. We feel much the same way you've just described this neighborhood. I come from Massachusetts. I know I've been working in hospitals that Partners has been in pursuit of.
Yeah.
So I've dealt with them from that perspective. And I can tell you now that our fear is, and we've kind of teamed up with Brown University and have the same ideas, et cetera. we feel that we are at risk of losing patients, especially those that are more complex.
Right.
Up to Boston, research, physicians, and we feel that it could have an adverse effect on the economy here. I believe that if we have the ability, and I do believe we have the ability, to sit down with Lifespan and Care New England and CharterCare, that we can figure out between the three of us how to keep healthcare local.
Yeah.
And I believe you have a tertiary hospital, you have feeder entities, you have the independents, et cetera. It can be done without the outside enormity
Yeah.
of what Partners brings to the economy here.
Well, listen, once they come, right, what stops them from acquiring Lifespan or elsewhere? And, once they're here, and I speak from the experience, and, we looked at 10 or 15 other similar business acquisitions in a range of different things. How does a governor ever control them, right? If they control, 3/4 of the of the hospital systems and healthcare system, there's really no check or balance that can be placed on them because it's really a megalopolis. And it's happened in Massachusetts. I mean, that is now a 70,000 employee. Charlie Baker's a great governor. He's the most popular governor. But I bet when the head of Partners calls, that's one of the phone calls he takes on the quick.
I would bet on that. And the other thing is the whole market dynamic of negotiating with third-party payers, negotiating with the state on Medicare and Medicaid dollars and how you're going to split that, fee for service, at-risk capitated contracts, et cetera. All of that kind of can take second space or second fiddle. If a megalith comes in like Partners, and instead of going through a negotiating process says, you are now going to pay us 15% premium for the honor of having us come into the
Now, I'll
state.
take a little bit of the devil's advocate for a second. They come in and say, listen, we're a better healthcare system, right? We're better ranked. We're with a better university. We're with Harvard Medical School, the #1 ranked medical school. And the patient who's sick says, well, I want the best, my brother's gonna die. How do we have the best of both worlds? How do we balance that?
Well, I think that, the structure that we have in place right now, we have everything from the independent community hospital. I have
Like a
one of them,
South County or a Newport?
or Our Lady of Fatima.
Yeah.
All the way up to an academic medical center, much like Roger Williams. And then we have the tertiary academic medical centers, which are the Rhode Island hospitals.
Right.
Anything that can't fit in that continuum of care would then be shipped out gladly, whether it's going to go south to Yale or north to Boston to one of the Partners or Dana-Farber. Those are the things that we could do. I do not believe, firmly do not believe, that they have to live and work here for that to happen.
Yeah, absolutely. What's the next step on, let's go back to Memorial. What's the next step on Memorial?
Well, I think the next step on Memorial, today, it's like anything else. It's like,
How happy was Mayor Don Grabian of Pawtucket, who might have, I think it was, what was it? Columbia football team didn't win a game for like 5 years. He's had as rough a year between Hasbro potentially leaving and the hospital closing, the GAM Theater. Was he the happiest man in America? Was this Christmas for Don Grabian?
I believe it was. He asked me if I could break out my old baseball bat from former days and go play for the local Pawtucket Red Sox. But I think he's very happy. I think that, it was an easy sell today.
Yeah.
Because everyone in the room, whether fire chiefs, police chiefs, the Senate and the House of Representatives who were there, members of the House and Senate, all the way to the mayors, et cetera, everyone was happy because it was good news and is good news for the region. We were going to get pushback. We will get pushback from those who look at it as either competition, increased competition, or other points of view. That's life.
Do you need to go back and get a new certificate of need? Do you need to go back to the health department? They rescinded that in the end of December, beginning of January, I forget the date.
Right.
Do you have to go through that formal process again?
Well, here's what we're hoping for. Right now, the building does not have any designation. So you're absolutely right. It's not designated as a hospital or clinic or anything like that. So really, if you want to look at it, we're buying real estate.
Yeah,
It's a
right.
real estate transaction. What we want to do is just be sure that we go through the process, whether it's, CONs or other,
Yeah.
to reinstate all that was there when Memorial closed.
Right.
So that we can provide to that community that need, the needy and underserved community, those services that they had prior to the doors being closed.
Next stop, Dr. Scott. Is that really the governor, Dr. Scott? Is that kind of the next
Everyone's
door
going
to
to
go?
Everyone's
Yeah.
going to be involved.
Great.
So you're going to have Care New England. You will have maybe Lifespan weighing in at the end of the day. You'll certainly have the community advocates. You'll have the local elected suite. You will have the statewide suite. You will have CharterCare, and it's going to be fun.
Yeah.
I look forward to this.
One of the biggest thinkers in healthcare is former director of health, Michael Fine. And Michael Fine says two things, and very important things that I don't think people totally think about. One is we probably have too many beds.
Mm-hmm.
The second thing he says is hospitals, especially in poorer, urban areas, are economic engines. They're incredibly important. A huge advocate of keeping Landmark going in Woonsocket. And you literally saw kind of the breath and hope and future of Pawtucket go out the door when Memorial closed it.
Right.
It's the centerpiece of the community. That seems to be a critical part of being a springboard, more so than 25 full-time employees in a baseball team, having hundreds of jobs tied to a healthcare facility.
Right, and I would agree with that. Some say that we are overbedded in Rhode Island. More and more of the procedures on a daily basis are going to an outpatient facility.
Absolutely.
Therefore, hospitals someday will become extinct, I think. But as you just said, you need to look at the demographics and the geographics of every state that you're in to say, where can the beds be taken from?
Right.
And I'm with you 100%. I believe that up in that area of Pawtucket, that Memorial Hospital serves not only to be a quick, easy, and affordable venue for them to get their health care, but also it's an economic engine to help the city of Pawtucket, Cumberland, and Central Falls.
What's the timeline? What do you think? You'll have this open, today's Thursday, Monday?
I was shooting for Tuesday afternoon, actually.
Excellent.
Yeah.
We'll be over for the ribbon cutting.
Wonderful.
Yeah.
I think a lot of it has to do with the tenacity of the local people who were in the room. If Mayor Grebian, were driving the bus, it would be Tuesday afternoon.
Yeah.
But like anything, we need to go through a process. And we'll get resistance as we go through that process, but we'll also get support. And at the end of the day, if we believe in what we're doing, which we absolutely do, if the patients believe, and the elected officials, as I said, then I believe it's going to happen.
Mayor Grabian would lay down in front of the governor's state police vehicle in order to get that hospital reopened. I think that's an absolute given.
He was very excited.
He was very excited.
Yes, and he's a big guy, so I kept having to move away from him. So.
Yes, right. How many times did he hug you?
Twice.
Just twice.
Twice, yeah.
Listen, I want to thank you so much. Listen, this is an ongoing discussion. This is a big discussion. Healthcare is one of the biggest parts of the Rhode Island economy. There are 70,000 people either directly or indirectly tied to the healthcare industry in Rhode Island. Two of the largest employers, Lifespan and Care New England, are paying some of the biggest. You're in the top 10, I think,
Right.
of private employers. This is a big economic decision. We talk a lot about $5 million tax breaks for GE for 100 jobs. This is 100 times more important.
It is.
From a macro standpoint of where Rhode Island's future is, and building on the success of Brown Med School and the existing healthcare infrastructure that's here now.
Correct. Correct. And that's why we're excited to be here, number one. And if we have the opportunity to contribute more than we have right now, well, quite frankly, we have turned around 2 hospitals, plus a
Right.
health center, plus a cancer center, plus we employ 3,000 employees right now who might not have been employed had we not come along.
Absolutely.
We want to take that same model applied to Memorial Hospital and move forward.
Great. Listen, I want to thank John Holiver for being on today. Big news coming out of Pawtucket and the potential reopening of Memorial Hospital. I want to thank everybody for tuning in. Welcoming you to the Navigant Credit Union Broadcast Center. We'll be back tomorrow at 3 and 4 o'clock. Thanks everybody for tuning in.